Folks, welcome back to another episode of the I Am GPH podcast. As you've seen in our previous episodes, or if you're new to the podcast, public health is so diverse. You can bring areas that apply from things that wouldn't be public health into one area collectively that makes it public health. Everything is public health. You can choose your own path. And our guest is someone that is representative of the multifaceted nature of public health, Brennan Rhodes-Bratton. Brennan is an avid researcher who is currently in the line of health inequities with a focus on the intersection of gentrification, food systems, and maternal child health. Brennan completed her DRPH at Columbia University in socio-medical sciences and is currently a postdoctorate fellow at the Center for Anti-Racism and Social Justice here at NYU GPH, who we have interviewed a lot of people from that department on the podcast as well. We can't wait to hear all about your journey and what you do and what's going on with you right now. Brennan, welcome to the podcast.
Thank you so much. I'm happy to be here.
So, I'd love to start off with your introduction to public health. When I was reading about you and when we connected, there was a lot of multifaceted nature to what you do. There's different areas to me. While all of these seem to fit in together, it also seems that they've come from different areas. So how have your interests formulated to where you are right now?
That's a great question. So I think a lot of us in public health, well, I shouldn't say us. I should stick to myself here. It's my journey. And I started off wanting to be pre-med. And I wanted to really work with the individual as a physician because I really want to affect change. And I saw it best by doing it with one-on-one. But over time, I realized that wasn't going to be my path and that I wanted to do something that was impactful with greater numbers while also still having those moments where you can work with an individual and hear their lived experience and kind of shine that light on it. And so I found my way into public health. And I got my master's, and then I went back again and got some more work. But in between, I worked at the Center for Children's Environmental Health at Columbia, and every single step of the way, it built to these questions around how our neighborhoods and the different structures within our society impact the individual level choices that we're making, and how those individual level choices also impact the structures that be, and that back and forth interplay really kind of began to be my focus and the nexus for my work.
You mentioned structure. So structure feels like, when I hear it, the bigger picture, right? So you found your pockets when it comes to structure, like this pocket applies, that pocket. How did you find your direction into the pockets that you're in right now? I know you were doing what you were doing in Columbia, and how did it's expanded into two to three different areas, and now you're at the Center for Anti-Racism. It feels very interesting to me how these have come up.
Well, see, for me, it's they all intersect. Like there's these, it's like where the disconnected like seamlessly connect. And so one of my most beloved mentors, Mindy Fully Love, I was in her office one day and we were having a conversation and I wasn't sure what to do my dissertation on. So many things were happening in the world at the time, and I've always been interested in cardiometabolic health and wasn't really sure how to get at it. And another interest of mine was food. Like a fun fact, I was raised on fast food. And so for me, I've always been intrigued by home-cooked meals and what does that mean and what does that represent. And so a part of it also is grocery shopping has been a different experience, I think, for me. We would go like once a month and get all the prepackaged goods and that's what we would have, right? So like Lunchables, SpaghettiOs, like Chef Boyardee, Gushers, like these are all things that were very prominent in my childhood. And when I was talking with my mentor about like what I should do, she said, what's upsetting you right now? And I took a moment, I thought about it, and I explained to her on my walk back to school, I would cross at the intersection of Lenox Avenue, which is in Harlem, Central Harlem, and 125th Street. And that's like a very famous corridor that runs from east to west across Harlem. And at that time, there was a vacant lot, and it was said that a grocery store was going to be moving in. Whole Foods. And then across the street, juxtaposed of this new development was going to be, was the boarded up Lenox Lounge, which is an iconic institution within the Black community, and so many amazing leaders and just fabulous entertainers have graced the doors of that space. And so you had divestment in like an iconic space, and across the street, redevelopment or revitalization or whatever word you'd like to put in there for a new space that is a grocery store, which was huge and fantastic and great, but it was also a space that represented change by the type of grocery store that it was. And so I explained to her that this feeling of kind of frustration but also hope was what was kind of having that tension, or kind of, I guess, pissing me off, for lack of a better word. And that's kind of what she said to focus in on. That's the thing to research. And so that's what I did. I tried to look at how, when you have structure, as in gentrification occurring in a neighborhood, how is that changing our relationship with food as the food environment then changes around you? And so that's how I kind of came to it, as thinking about the structure and the individual. And then also with moms and their kids, because often we see that mothers are the ones making the decisions around food in the home. And so if the mother is the one going out and going grocery shopping in these new spaces as it's changing, then how is their relationship with food and also their children's relationship going to change or not change in the context of what's occurring through these different social processes? And so that's kind of what was born and out of that conversation and out of being in that space over time.
That is actually such. I pictured myself there right now and seeing how that. I've had a few people on the show that are in the world of nutrition, and their life is nutrition. When I say the word nutrition in public health, what comes up for you?
That's a great question. For me, in my head, I see that like quintessential plate of a well-balanced meal and like a family around a table and individuals trying to like enjoy a meal. I don't necessarily think about the macronutrients. I don't think about like how processed the food is or the level of vitamins or any of that kind of stuff. But I do also think about who has access, who is available, who is able to get the different types of foods that they want to bring to their table, and how that might change based off of social and economic determinants. And so that's, for me, nutrition kind of holds that whole space.
Let's take a step back. Social and economic determinants. How would you describe that? What does that mean?
Okay. So for me, that's really looking at like, what does somebody have the resources for, whether it is within themselves or within their family or within their community, and how that can either provide or hinder the types of food choices that individuals can make. And so when I'm thinking about nutrition, I also think about like nutrition security, in the sense that not just food security, right, but making sure that somebody can have a well-balanced meal, is, I think, what I really focus on.
Wow. Where is your journey in nutrition taking you right now? So what are you focusing on? What's going on in your journey? What's next right now?
So it's exciting, I guess. There's like a few different spaces that it's going. In one space, during previous research from working with mothers and talking about like how the relationship with food may or may not have changed in the context of gentrification, I learned something happened to a lot of moms in the study that I had worked with. Two things, actually. One of the themes that came out was this internalized stigma around cultural heritage foods. So I would ask individuals, like, what's your favorite food? And we would have a lovely conversation about this. And then I would ask, so how healthy do you think this food is on a scale from 1 to 5? And I was really shocked how many individuals mentioned their favorite foods that were heritage foods as being very unhealthy. People would say things like, but we eat disgustingly and things of this nature. And it was really upsetting to me to hear somebody talk about foods that seemingly were pretty healthy, a well-balanced plate, as being so, unhealthy. And so I started asking myself, like, what is happening for that individual to get to that kind of connection with their food in that way? How do they get to a point where they internalize it to be so negative? And so that I started on a journey to try to understand a concept of like food stigma in this space. We know that there's stigma around food insecurity. We know there's stigma around weight, and other aspects, like we even see stigmas within, unfortunately, like eating disorders and things of that nature. But we don't see in the literature too much about this notion of stigma around what we're eating, if it's related to our ethnicity or culture or race. And so that's something that I want to explore more.
What were some examples of people judging their cultural heritage food, them speaking of their own food as something that's unhealthy? How did that, what's incorrect perhaps about their mindset, and how can we, where did the research take you to change that, and what unlocked for that?
I wouldn't say anything about their mindset is wrong. I think what ends up happening is we live in a space where we're told like a healthy meal looks like this, and you're told this often through media or even with your doctors or even us within public health, and what we're saying is to eat. And if we're not giving messages that are culturally relevant and are, more understanding of the different aspects of cuisine can be healthy, then that message could then be internalized as, having a mindset of something being unhealthy when it's just rice, beans, and chicken. So I had an individual once tell me how much they really wanted to pursue eating asparagus, but didn't really acknowledge the other different heritage greens that she was eating as well.
Wow.
Right. And I'm like, well, what's wrong with these greens? These sound great and healthy and lovely. So I think we in public health also need to be very mindful of the messages that we are giving around foods when, we just need to be inclusive, I think. And that's one of the projects that I'm working on right now.
Is that at the center you're in, or that's a separate project that you're working on? Through the center or something else?
Yeah, it's yeah.
Wow.
Yeah. So I think the beauty of the work at the center is that Dr. Goodman has placed some really just brilliant minds in the same room where you can kind of work off of one another, but also have very different ideas of how anti-racism can show up within social justice and public health. And so with that, like my space is kind of within cardiometabolic health and gentrification and moms and kids and stigma and all these different things. But I think we all have a connection back to how can we see the world a better place when this invisible thing of racism is, impacting our lives.
When I had them on the podcast as well, this was, I think, last year or a few months ago, and it blew my mind to hear that I didn't even think racism is a public health crisis. It's so interesting being in this world and speaking to all of you that there's these areas that one doesn't think as a public health issue, but these are the biggest public health issues. When you hear of racism, these gentrification comes up, your areas come up. What are some other things that might surprise us about racism when it comes to public health?
I think that in our country, racism is so ubiquitous that it becomes difficult to even see. And so our work is centered upon making it visible, and it's in so many different spaces. So it's I wouldn't say we can pick and choose from a lot of different health conditions and factors that will increase the risk of unhealthy outcomes. So unfortunately, I think it just as much as we say public health is in everything and everywhere, I think unfortunately, racism has its legacy in a lot of spaces where we also see health outcomes.
I'm fascinated by your journey from Colombia to giving me all the stories and how your research has transformed into where it's gone. Do you see it pivoting for yourself at this time, or do you see it evolving from these are pillars and now these pillars are forming a larger building in your research?
I think that food will always be a part of my work. I think that social theory will always be a part of my work and inform it. And I think health can show up in a lot of different ways. One of the things that I have had an interest in recently is epigenetics and thinking about how larger structural health determinants of health, like gentrification, how could that show up in our under the skin, in like a very intergenerational way. So that's something that I've been trying to think through, and that's very in the beginning stages. So, but I do think that there is there's some answers there that could help us in trying to understand what is going on within our bodies as it relates back to this relationship within our environments, right? So one of the things that I'm very much interested in is this construct called habitus. And for me, it's looking at structure in the individual. And if we take that another step further, we could also take it to maybe our genes, right? So it's like keep on pushing the boundaries of how we interact with ourselves, with others, with our environment.
Tell me more about habitus.
Tell you more about habitus. No one wants to know that much about habitus.
It has a significant influence, and I know you sent us a lot of information about habitus. It has a significant influence on your work. There must be multiple people, frankly, listening to this podcast right now that have that multifaceted mindset but don't know how to channel it, and you are a representation of that. How has habitus influenced that for you?
Oh, wow. Habitus is it's something that I think can open up a lot of windows to what we see in the world in a way that doesn't hold us to something big or macro or something small in the individual. It makes us think about our world as this kind of fluid and holistic thing that is in time and space. And it doesn't ignore that interplay that occurs, right? And because we have the social structure, we have the agency, and we have that interplay within habitus, right? It's formed within that back and forth relationship between our lived experience and also what we experience with our culture, with the socialization, with our neighborhoods, and thinking about how all of these things are our building blocks to who we are and the decisions that we make, and then how those decisions that we make then create, again, that neighborhood, those policies, our socialization within our structure of our society. Yeah. And so it's this back and forth that I think is really a beautiful concept to help us think through very complicated issues that require to think about something in a multifaceted approach instead of just a one
dimensional.
Mm-hmm. Yeah, I think that that construct allows us to do so.
Wow. Oh man. Okay. You've been a researcher for a long time. We can say that you've been doing research for a very, very long time. What is it like being a researcher? Some folks might be listening thinking, what is this research thing? I mean, is it something I have to do for a paper? What is life in research when it comes to public health? What does research mean for you?
I think research for me it's having a question and trying to find an answer. And you get to explore questions in ways that with new methodologies, allow you to, answer things that you might not have been able to previously. Or there's also the caveat of that you're answering questions that you have known for a long time that are of concern, and yet we have to provide evidence to do so. So I think being in research for a long time, I think there was a part where we were always providing evidence of health disparities between groups within our country, where now we're pushing for more of an equitable lens and saying, okay, if we know that these differences exist, why do these differences exist? Let's change them, right? It's no longer okay just to research for the sake of there's a difference in X and Y. We just shouldn't do those things. So for me, research allows you to, provide information to make change, right? And so that's why I got into this whole thing in the first place. I came into public health with a very advocacy lens, and it's been very rewarding to see that public health kind of re-embrace the aspect of advocacy through science, and to really honor wanting to do this work in a way that's going to provide information that can make equitable changes.
Wow. I love it. It's very similar to the work you're mentioning about it's seeing the unseen is what I heard in that. And it's very similar to the center that you're working at as well. Seeing the unseen. We're making the invisible visible. We're showcasing it. Research has a big role in doing that. Let's ask this final question that I asked to many guests in different ways. To you, what is the biggest public health crisis right now? Something that if you had a magic wand that could disappear, what's the one public health crisis you would choose? Obviously, there's many of them, but the one that's closest to your heart.
That's a really tough question, right? Because the public health, trained individual wants to choose the thing that's going to alleviate the most pain and harm for as many people as possible, but yet you say the thing that's closest to my heart. Even though I think that they may be similar, they might not always be the same. So now I'm trying to think off the top of my head, what is the number one?
So perhaps let's rephrase that question because it's an unfair question, and every guest gets annoyed when I ask that question.
Okay.
So I'd say the public health, anything in public health, a crisis, an area that's closest to your heart right now, where it's going. You mentioned a lot of things, right? So something that where your mind starts immediately. You mentioned epigenetics, you mentioned nutrition, you mentioned gentrification, you mentioned racism. What's the one that is consuming most of your time right now and you see is going to be the next few years?
They're all connected.
They're all connected.
Right. But one I haven't mentioned yet, but it really is, again, interconnected and intertwined. And a lot of the things that we mentioned is climate change.
Wow.
Right. So once we, again, thinking big and thinking about structures and all of these aspects, right, our climate is impacting our food systems, and our food systems impact what's available for people to have on their tables, right? And so all of these different things can impact an equitable and just food system that we all need to eat in order to survive, and that's going to impact what we're capable of showing up and bringing to the world each day, if we're nourished or not, right? So that's kind of the bigger picture.
Beautiful answer. I'd even say public health. There's no magic wand to public health. It's a big rope, and that's the wand that we have to. It works together. Everything is collaborative over here, and your answer kind of showed us that. Brennan, I can talk to you forever, but we're at time, and this was a true treat. Thanks for being on the episode.
Yeah, thanks for having me. Sorry it took so long.
No, you're good.
Thank
Folks, one-dimensional screen, but a multifaceted episode. We'll see you in the next one. Thanks for tuning in.